Well, I appreciate that you directed that toward me, but I'm going to defer that to Dr. Sicente. My point about patient compliance is that whatever length of time, what you do not want to do is, and it's easy to do, we've all done it, taking any drug, any medication on a consistent basis is something that you have to remember. And the better you feel, the less likely you are to remember that. So the only way I would respond before, again, deferring to Dr. Sicente is whatever that, I suppose at some level a shorter course would be better because you have to remember something. At least in my case, the least amount of time I have to remember it, the better. But my main point is just patient compliance with whatever the course is. And then I'll let...
Yeah. So the specific drug that you're referring to is azithromycin. So it's actually a 5-day course in a Z-Pak. And it's a macrolide antibiotic, so we have different classes of antibiotics. And it is better than the other macrolides. And the reason you only need to give that for 5 days is because it stays in our system longer. So it's really just a simple matter of you don't have to take it for 7 days or 10 days because it has a long half-life. And in fact, it stays within cells for a long time. So giving 5 days of azithromycin is like giving 8 days of erythromycin, but it's a once-a-day drug, and so it is better than the other drugs in that class. It's the same. Yeah. Well, again, it's you're more likely to finish a 5-day course of anything than you are a 10-day course, and again, it's much easier to take an antibiotic once a day or any medicine once a day than it is to remember to take the old-fashioned erythromycin, which was 3 or 4 times a day. And again, we look at side effects. It actually has a better spectrum of activity than the other drugs in that class, and so it has advantages over other members in that particular drug class.